The internal quality assurance cell of the institution is concerned about the well-being of all the stakeholders of our institution, that is teaching and non-teaching staff and students. So this year, the Internal Quality Assurance Cell is planning to organize a series of webinars related to health and hygiene. Today's webinar on heart diseases and heart care is the first among the several such sessions to follow. Dr. Sister Gigi Jonama Xavier, our beloved principal, is the source of inspiration for all the endeavors taken up by the IQAC. The leadership and guidance of our principal has definitely ignited us to progress beyond excellence. On behalf of all present here, I extend most hearty welcome to you, sister.
Thank you, Sheena.
Dr. Aju Paul Pazhenkottil is a consultant cardiologist and lecturer at the University Hospital of Zurich, Switzerland. He studied medicine at the University of Zurich with internships at Children's Hospital, Harvard Medical School in Boston, and also at All India Institute of Medical Science in New Delhi, India. He graduated in medicine in the year 2008 and thereafter trained in internal medicine and also in cardiology. Dr. Pazhenkottil is clinically and scientifically focusing on cardiovascular imaging, specifically on endocardiography, cardiac computed tomography, cardiac magnetic resonance imaging, and nuclear cardiology. His main area of research includes the role of cardiac imaging in patients with coronary artery disease. Dr. Pazhenkottil is the author and co-author of more than 120 scientific papers and related articles in international peer-reviewed journals. Moreover, he has authored and published several book chapters in cardiovascular medicine and acts as a reviewer for different international journals. As a lecturer at the University of Zurich, Dr. Pazhenkottil is regularly involved in teaching medical students and residents, as well as cardiology fellows from all over the world. He has won several awards, including the prestigious Homi Bhabha Award of the Nuclear Cardiology Society of India. Respected Dr. Aju, on behalf of principal, staff, and students of St. Xavier's College, I cordially welcome you to this online gathering.
Thank you very much.
Dr. Sister Stella, our dynamic vice principal and assistant professor of Department of Chemistry, always encourage and support the activities of Internal Quality Assurance Cell. Hearty welcome to you, sister. I extend a most cordial welcome to all the participants of this webinar. I hope all of you will have a fruitful interactive session with our esteemed resource person. Thank you. Over to you, Sonia.
Thank you, ma'am. Our principal, Reverend Dr. Sister Gigi Jonama Xavier's commitment and concern for the entire Xaverian fraternity is commendable. Her unstinted support for each and every initiative needs special acknowledgement. I now invite Reverend Dr. Gigi Jonama Xavier to inaugurate our health webinar series. Over to you, sister.
Thank you, Sonia. A warm good morning, one and all. Chief guest of the day, Dr. Aju Paul Pazhenkottil, Senior Consultant, Cardiac Imaging Department of Nuclear Medicine, University of Hospital, Zurich, Switzerland. IQAC Coordinator, Dr. Sheena Xavier. All the faculty members and administrative staff of the St. Xavier's College, and my dearly beloved students. Internal Quality Assurance Cell of St. Xavier's College for Women, Aluva, is marked for its verve and vigor, and it always pursues quality initiatives. In the path towards the welfare of the whole institution, myriad enterprises have to be taken up, upholding the cause of the staff, students, and the wider community. Intent to fulfill the IQAC is presently organizing a webinar series for the faculty, both teaching and non-teaching, and also the students. The theme of the present webinar series is overall health, as it is of prime importance in the wake of the pandemic. As Joseph Perez has well said, physical fitness is the first requisite of happiness. Yes, it is high time we thought about the need of maintaining a healthy body so that it will positively contribute to the general happiness. It is highly appreciable that the IQAC has taken such an initiative to lead all of us to the secrets of fitness and well-being. May I take this opportunity to congratulate the IQAC team for such a venture. Today, we are starting with the core of our health, which is our heart. To refresh our knowledge of owning a healthy heart, we have a highly venerated resource person for today, Dr. Pazhenkottil, who is a senior cardiac consultant working at Switzerland. We deem it really a blessing for the institution to have an opportunity to listen to him. I express our gratitude to Dr. Aju for taking up our invitation. The health of our teaching and non-teaching faculty is a concern of the institution. So is the health of our students also. Hence, such a webinar series is being organized with the belief that the beneficiaries will gain much to improve and maintain their health. I wish all the participants a fruitful session ahead. I pray that all the of the webinar series would cater to the overall health and may turn out to be a resounding success. With such a positive note and warm wishes, I hereby formally inaugurate the webinar series. Thank you all.
Thank you, sister.
Thank you.
Thank you. It is a rare opportunity for the Severian family to savor the expertise of Dr. Aju Pazhenkottil. Dr. Aju Pazhenkottil is a consultant cardiologist and lecturer at the University Hospital of Zurich, Switzerland. Dr. Pazhenkottil is author and co-author of more than 120 scientific papers and related articles in international peer-reviewed journals. He has won several awards, including the prestigious Homi Bhabha Award of the Nuclear Cardiology Society of India. Dr. Pazhenkottil lives with his wife and children in Zurich, Switzerland. In his free time, he enjoys spending time with his family and friends. He loves traveling, especially to Kerala, from where his parents originally moved to Switzerland more than 50 years ago. So we are so happy to have you here, sir. So let this webinar be an answer to our doubts and queries related to heart problems. Over to you, sir.
Thank you. Thank you very much for this kind introduction. Dear Reverend Dr. Gigi Xavier, Principal, dear Reverend Dr. Stella, Vice Principal, dear Sonia Marcos, dear Internal Quality Assurance Cell, and all faculty members from St. Xavier's College. I'm happy to be here to attend this webinar and to give you a talk on heart disease. It's an absolute privilege to be here, and I will start with my presentation. Let me see. Can you see my presentation? Can you see my presentation?
Yes, sir.
Yes,
Yes.
Doctor. Yes.
Perfect. So welcome to everybody, students, faculty members of St. Xavier's College, to this international webinar on heart disease and heart care. It's an absolute honor to be here and to be one of the speakers here at this webinar. Thank you very much for this kind invitation. Now, let me start with some newspaper headlines. These were all headlines from newspapers in India in 2018-19. At that time, the heart disease is top cause of death in Kerala. Kerala most at risk of cardiovascular disease. You see here, heart disease, people in Kerala at highest risk. So this was all based on 2 studies done in 2018. I will come to these studies later on. So this was one of India's biggest studies done at that time. And they found out that 20 out of 100 adults over the age of 30 in Kerala are at risk for suffering a heart attack. This is the highest in any state in India. So that's why it's absolutely important to talk about heart, to talk about heart attack and how we can prevent heart attack. That's what I'm focusing today. Before I start, let me shortly introduce myself. Maybe I'm working as a doctor, as a consultant cardiologist in the University Hospital in Zurich. And I believe it's not only a profession to work as a doctor, but also a vocation. The vocation to be God's love, God's compassion, as Mother Teresa has very nicely said. And it's absolutely a privilege to work as a doctor. As you have heard, my parents are migrated to Switzerland. I'm happy that my parents are also here attending this webinar. They migrated to Switzerland. They're living here in Switzerland. And this is a picture of a mountain here, Matterhorn. This was during COVID pandemic. They showed the Indian flag at this Matterhorn as a sign of sympathy, as a sign of concern about India during COVID-19 pandemic. During my daily practice, I'm taking care of my patients, but I'm also doing research. My main focus is cardiac imaging with different modalities. I will show you later a little bit more about this. And of course, teaching faculties, teaching students, also teaching other doctors from all over the world at our hospital. Now that's the overview of today's talk. The first chapter, the first part, the history and arts of heart disease, is especially dedicated to you, because I believe I heard that you are especially arts and science college. So that's why I included this first chapter, history and arts of heart disease. After that, we will talk about human heart and its function. So I will go to the basics. I will tell you a little bit more about heart disease. After that, worldwide, how it is in India, how it is in Kerala. And finally, in the second part, I will focus on prevention of heart disease, which is a very important topic. Then a heart disease treatment, what we have different treatments here, and the modern approach to heart disease. So let us start with history and arts of heart disease. The first images or the first paintings of the heart were back in ancient Egypt, so thousands of years ago. This is a heart you see here. This was some kind of a celebration they have, or a ceremony of people who died. So these were the first paintings of the heart we know today. The first drawings of the heart, really nice drawings and very precise drawings, are from Andreas Vesalius. This is in the 16th century. He was a doctor and a pathologist at that time. He was the first who really studied dead bodies. He looked at the dead bodies and he could show how these organs, the internal organs, how the body was looks like and how the heart looks like. Especially also at that time was Leonardo da Vinci. You know, he's quite famous. This was also in the 16th century in Italy. He did also dissect dead people, and they look at this heart. This is how he painted the heart. These are quite impressive images and impressive drawings at that time of the heart. The first description of blood circulation, the first one who found out that the blood is circulating in our body, is William Harvey. That was in the 17th century. He said the heart is the basis of its life, its chief member, the sun of its microcosm. On the heart, all its activity depends. From the heart, all its liveliness and strength arise. Equally is the king the basis of the kingdoms, the sun of his microcosm, the heart of the state. From him all power arises and all grace stems. So he compared the heart to the king, which is the basis of the kingdom, and the heart, the basis of the life. So he really understood how important the heart function is. Let me go a little bit forward in the history. In the 19th century, it was Professor Lenach in Paris who found out how the stethoscope works. This is the first stethoscope. You see, this is a quotation from that time in London Times in 1834 about the stethoscope. So he said that it will ever come into general use is extremely doubtful because its beneficial application requires much time and its character are foreign and opposed to all our habits and knowledge. So nobody took it serious at that time. Nobody said that the stethoscope will be used in daily routine, but of course you all know all we doctors are using stethoscope every day in our daily practice. So it's absolutely important and essential to have stethoscope. This is how it looks like the first ECG that was in the beginning of 20th century at the university in the Netherlands, Leiden University. Professor Einthoven did the first ECG. You see here how complicated it was at that time. They had to put their arms and the feet into salt water so that they could generate an ECG. Nowadays it's much more simple. You see the ECG today, very easy and very simple a tool which is very helpful for us cardiologists especially. Looking at the medical imaging modalities, you can see it started all in the late 19th century with the introduction of X-ray by Wilhelm Röntgen, that was in Austria, and findings of radioactivity by Marie Curie, you know this as well, in the late 19th century. After that, different imaging modalities have occurred, developed, CT, PET, MR. I will tell you a little bit more about this later on. These are scanners from our center. You see here we can combine different modalities like PIT or SET, CT on PET and MR to have hybrid imaging technologies. Now they have won for Wilhelm Röntgen and Marie Curie received the Nobel Prize for the introduction of X-ray and radioactivity at that time. You can also see here how the images developed during the last 15 to 20 years. So it's a huge advancement we see in medical technology. You see how the images looked like 20 years before. Nowadays we have precise images. We have a precise diagnostic tool so that we can have a personalized treatment and monitoring in our patient. This is a heart of one of our patients at our university hospital, and you can see here tumors around the heart in this patient. Now let's move on a little bit to human heart and its function. It's a little bit of repetition. You all know much about heart, but I will focus on a little bit on the anatomy and physiology about heart. You all know the heart is the center of our chest. You see here the right lungs, the left lung. You see here the liver, the intestinal organs, and also the ribs here. And the heart is at the center of our chest. The main objective of the heart is to carry blood to the whole body. You all know that. So this delivers blood to the arms, to the brain, to the feet, everywhere. The size of a heart is around the size of a fist. So that's to compare to know how big the heart is. Normal heartbeat is around 60 to 100 times per minute. So a total of 3.5 billion times a heart is beating per life. So quite a huge motor we have in our body. And so we should really take care of this motor we have in our body. The heart delivers approximately 10,000 liters of blood per day. So really important that we really take care of our heart. And the weight of the heart is only around 300 to 350 grams. Now, if you look a little bit closer, you see here the main vessel. This is a so-called aorta. And from the aorta, you see the vessel going out of the first vessel going out of the aorta. And these vessels are called the coronary arteries. So these are important vessels. And I will show you some more images, and you can see here the heart open up. You see here the blue one is showing us deoxygenated blood. So blood which is coming from the body, from the upper part, from the lower part, it goes to the right chamber of our heart. This blood is carried to the lungs, where again we receive oxygen. After that, the blood is coming back to the left chamber, and from the left chamber it goes to the aorta, which is the main vessel giving the blood to the body. Now you can see here the left chamber and the right chamber. It's mainly basically muscle. Heart is not 80 to 90%. It's a muscle. This is an explanted heart. This is the real heart from one of our patients. He was transplanted. He was transplanted at our institution, and this is how the real heart looks like. This is a photography of his real heart, which was explanted. He received a new heart. So it looks quite similar to the illustration which you see here. Now this is important. What is a heart attack? A heart attack basically, is also called a myocardial infarction. It occurs when the flow of blood to the heart is blocked. So when one of or more of these coronary arteries are become blocked. You see here one illustration of coronary artery, and you see here the blockage here. And if one of the arteries become blocked, then the oxygen supply to the muscle is reduced, and you see here the interrupted blood flow can damage or destroy part of the heart muscle, as you can see here. So that is in fact a heart attack. Now, what are the symptoms of a heart attack? The common heart attack signs and symptoms include a pressure, tightness, pain, or an aching sensation in the chest or arms that may spread to the neck, jaw, or back. It can also be like abdominal pain, nausea, vomiting can be sign of a heart attack, shortness of breath. Typically also cold sweat is one sign of a heart attack, and dizziness that can be also a sign of heart attack. Some heart attacks strike suddenly, but many people have warning signs and symptoms which occurs hours, days, or weeks in advance. The earliest warning might be recurrent chest pain or pressure. This is so-called angina, and that's triggered by activity and relieved by rest. So especially when you walk fast, if you feel chest discomfort or pain, that might be caused by a temporary decrease in blood flow to the heart. Not all people who have heart attacks have the same symptoms or have the same severity of symptoms. Some people have mild pain, others have more severe pain. For others, the first sign may be a sudden cardiac arrest. However, the more signs and symptoms you have, the greater is the chance you're having a heart attack. Now let's move on a little bit to look at the heart disease worldwide in India, and I will also focus here on Kerala. If you look at the cause of death worldwide, these are the top 10 causes of death. You can see here tuberculosis, number 10, diarrhea, but also road injury, traffic accidents, diabetes, obstructive pulmonary disease, but stroke. But the number one cause of death is ischemic heart disease. Ischemic heart disease is another word for patients who have had a heart attack. So ischemic heart disease is the top number one cause of death worldwide. Now, if we look a little bit closer to India, what are the causes of death in India, then we again see 1/4 of all death causes are based on cardiovascular disease, so 23.3%. Again, we have here motor vehicle accident, it's around 5% here in India. We have cancer, around 6%, respiratory disease, and so on. But still, ischemic heart disease or cardiovascular disease is top cause of death in India as well. These are the two studies I talked before, and these were both published in 2018, very nice studies done in 2018. That was really causing this concern, and these newspaper headlines I showed you before were based on these two studies. So one study is on global burden of disease between 1990 and 2016 in India, and the other one is with almost 8 lakhs of adults on geographic and socio-demographic variation of cardiovascular disease risk in India. And now I will show you some slides of those two studies. So look at the ischemic heart disease. This is one image from that study, and you can here see the prevalence per 100,000 of patient, and the average 10-year risk for cardiovascular disease is really widely varying among states in India. So from 13.2% in Jharkhand to 19.5% in Kerala. So the highest prevalence here in red is in Kerala, Tamil Nadu, Maharashtra, and Punjab for ischemic heart disease. They looked a little bit more on general cardiovascular disease, and what they found again here, Kerala is in a prominent place here again. The prevalence is highest in Kerala and Tamil Nadu and Punjab compared to the other states. If you look at the stroke prevalence, again here, we see that Kerala is in the higher prevalence rate here compared to the other states. They also did compare rural to urban areas, and also here the age standardized 10-year risk of cardiovascular disease event is comparable, is also highest in Kerala. It's not dependent on rural or urban areas. Now that, so far, that is the bad news, of course, for our Keralites. But what is the good news? Good news is we have possibilities to prevent heart disease. And that's what I would like to focus. That's absolutely important. How can we prevent heart attacks? How can we look that we do not get a heart attack? So what are the risk factors? On one side, we have non-modifiable risk factors. These are age. With advanced age, of course, the risk of a heart attack is higher. We have the gender. Male gender has a higher risk for heart attack than female gender. We have family history of heart attack or genetic predisposition. For all this, we cannot do anything against this. This is a non-modifiable risk factor. But we have a lot of modifiable risk factors like smoking, high cholesterol, high blood pressure, diabetes, the so-called sugar disease, obesity or overweight, lack of physical activity, and stress. If you look again at this one of these studies, then you see here again the high blood pressure rate. The prevalence of high blood pressure is highest in Kerala compared to other states, and also high cholesterol level is the prevalence of high cholesterol is higher in Kerala than in other states. So it's really not only that the disease is higher, but also the risk factors are higher in Kerala, unfortunately. These are again some images, figures from that study. You see here, left upper side here, the mean body mass index, which is an index showing as the obesity, the overweight. Again here, Kerala and Punjab are the first and the second states with the highest body mass index. Means systolic blood pressure is high in Kerala, and also high blood glucose prevalence. This is in Tamil Nadu and Kerala are the highest blood glucose prevalence. Looking at the smoking prevalence, this is good news. This is quite low, especially in female. This is female. These are the male, especially in female. This is really, really low throughout India. And this is absolutely a good point for India, that the smoking prevalence is low. Now, what can we do? If someone is smoking, of course, stop smoking. That is number one. Lower high blood pressure. What can we do here? Reduce salt intake, reduce the salt in the food. That can help to reduce high blood pressure. What else can help to reduce high blood pressure? It's to be physically active. So we recommend to be physically active every day, 5 times a week, if possible, for 30 minutes, because being inactive contributes to high blood cholesterol levels and obesity. It's also important to reduce weight if you're obese, and to reduce stress if somehow possible. And one important point is also choose good nutrition, healthy food, which is absolutely important. What is healthy food? And that's what I'm going to talk about right now. Good and healthy food, especially our fruits, vegetables, fish, some nuts also. You see here the so-called healthy eating pyramid. These are the food that we can eat without any problems, while these are the food like sugary drinks, sweets, red meat, white bread, white rice, that should be reduced in our daily routine. And also you see here fish is preferable. Fish is better than meat, especially red meat is not recommended that much. And of course, vegetables and fruit should be in our daily routine, and whole grain products like brown rice, whole wheat, pasta, and oats. That are all food that should be included in our daily food routine. Now let's move on to the heart disease treatment. If someone has heart disease, what are we going to do as doctors? So coronary angiography, you probably have heard about this. So you see here what we are doing as cardiologists. We are putting a catheter here to the artery. We go up to the heart and put the catheter into the artery, and you see here the block. We can look at the block. You see here one of this image from one coronary angiography, and you see here this is a normal vessel. This is again a normal vessel, but in between you see here the block. It's quite narrow here at this place. So this is the so-called block, an ischemic heart disease. For many years, the only option we had if someone came with this block is to do a bypass surgery. This was the only option with an open heart surgery. What is a bypass operation? A bypass operation is we put an artery, an external artery, or the left intramammary artery, into the artery after the block. You see here, this artery is put here after the blockage in the coronary artery. So for many, many years, bypass surgery was the only option we had. Now, in 1977, Dr. Andreas Grünzig, he was a professor and a doctor at University Hospital in Zurich, and that's why we are very, very happy and very proud, of course, as cardiologists at the University Hospital in Zurich, because he was the first one worldwide. He performed the first coronary angioplasty. He invented the balloon dilatation, so the first angioplasty was performed in Zurich, Switzerland. So you see here this coronary artery with the block here. So he introduced this new technique. He went with the wire here to this block area and put a balloon like here, so that this artery is expanded again, so there is no block and the blood is flowing again normally. So that was in 1977. After that, of course, this technology developed again and again, and nowadays we have this so-called coronary angioplasty stents. So first of all, we go there with a wire, we put a balloon there and dilate this coronary artery, and after that we put the stent here into the coronary artery. You see here how small this stent looks like. So that's the treatment of a heart attack. The heart attack in patients with heart attack, they should be they should go to the ER, to the emergency department very soon, and to the ER where a coronary angiography is possible. And this is the final treatment of a myocardial infarction or a heart attack. And of course, patients will receive also medication after that. Now, a little bit to close my talking about the modern approach to heart disease. What do we have right now? We have modalities to prevent and to early detect ischemic heart disease. So this is my focus area, cardiac imaging. So you see here a CT, computer tomography, you see a PET scanner, an MR scanner, and also the ultrasound. And we can also combine all these different modalities. We can assess images of the heart without going into the heart, just looking from outside of the heart, we can assess images of the heart. And this is how it looks like. So this is a 3D heart computer tomography. So this patient came to our department and we performed computer tomography without going or doing any surgery. We can look at his heart. We can do a 3D model of his heart by a computer tomography. You can clearly see also here the coronary arteries. Now this is how it looks like. This was one of my patients. He's a 45-year-old male patient with chest pain, and we performed the computer tomography. This is at our institution, the computer tomography, and you see here, you can see the calcification, the block here in one of these vessels here. There's a block. This is another patient of mine. He had a little bit more severe blocks here. You can see here at the beginning of this artery, there is a severe block here with calcification here in white, and we also have the possibility to go through to go like a movie through these coronary arteries and to see where there is any block. Again, this is quite a young patient in our department. We performed a CT and we could see there are several blockages here in these coronary arteries. So this white one is the normal blood flow, but you can see here the block here in the beginning of the coronary artery. So it's possible to detect coronary artery disease at a very early stage. Of course, we can combine different technologies. We have here on the left side, you see an ultrasound image of a heart. This is what I'm doing every day, looking at the function of the heart, looking how the heart is beating. And here on the right side, you see a combination of a CT and a PET image. So we can look exactly where there is no blood flow, there is a reduced blood flow, where there is a block, and so on. So this is quite an important tool we have nowadays. And again, here some recent advances we can combine ultrasound technology with CT technology, and there's also a huge potential in detection of heart disease with new imaging technologies. So coming to the conclusion, heart disease is a leading cause of death worldwide. People in Kerala, unfortunately, are at highest risk of heart disease in India. And prevention, but the good news, of course, as I said, the prevention of heart disease is possible, like this diet, physical activity, and that's absolutely necessary. And it's important that people, that they are aware of this. The awareness of people in Kerala, in our home country, is absolutely important. And of course, new cardiac imaging technologies for early detection of heart disease is increasingly available, not that much in India, but more and more, and of course it will also be available soon in India, I believe. With this, I would like to thank you for your kind attention. This is the University of Zurich. You see the beautiful lake of Zurich with the mountains. This is the place where I'm working. And thank you very much once again for the kind invitation. And I will give back the word to you, Dr. Sonia Marcos.
Thank you, sir. So now the session is open for questions So you can either unmute and ask your question, or you can share it in the chat box.
Ma'am, I have a question.
Yeah, please, Hannah, ask.
Good morning, sir. I'm Hina
Good
from the
morning.
Department of Physics.
Good
So I have
morning.
got a question for you. How would you rate the Indian cardiac care setting in the global context?
Sorry, I didn't ask the first part. The
How
global.
would you rate the Indian health system, particularly in the context of cardiology in the global context?
I really believe that the Indian health system is quite good, especially in Kerala. We have a lot of very well developed hospitals and also very good doctors in Kerala and in India. But I think it's the awareness of this heart disease or disease in general is a bit lower than in other countries. But I believe the health system, in fact, is quite good in India. And we have, of course, the advanced technologies also in India, in different hospitals I visited during my visits in Kerala.
Thank you, sir.
I have a question, doctor. I'm Dr. Sheena
Yes,
Xavier.
Yes, please.
I have a family history of heart diseases. My father had an attack last 15 years ago. His brother and sister died due to heart diseases. Now, I would like to know how this family history will affect my health, whether I can take any precaution to prevent this heart diseases.
Yes, very good question and absolutely important. And I think this is absolutely important because you should be aware. I mean, the risk is higher, as I said in my talk. Family predisposition is one of the risk factors. We cannot do anything. This is genetic, but we should take precaution. We should have checked our heart. We usually say it's around in the age of 40 or more, we have to check our heart with a cardiologist to see if everything is fine. So there are possibilities to check the heart, to look at the laboratory, to look at the blood cholesterol level, for example, the blood pressure. That's absolutely important, especially if you have if you know that there are people who have had heart attacks in the family. You should be aware that the risk is higher for you or also for siblings to have a heart attack, and it's absolutely important that we go to the cardiologist and let's check the blood pressure. We can check a lot of laboratory measurements like the cholesterol level. We can also look at the blood pressure level. We can look at the exercise tolerance you have, doing a bicycle exercise test. So that's absolutely important. I would really recommend to do this, and of course the cardiologist would recommend to do or to take any medication if that is necessary. We have good medications, in fact, to reduce cholesterol. These are the so-called statins. That is really helpful to reduce cholesterol, in fact.
Thank you, doctor. Thank you for the suggestions.
So I have got one more question.
Yes, please.
Is there any female-specific disease which can increase the risk of women's risk in heart diseases?
Female specific, that is an absolutely hot topic right now in cardiology. There are a difference in gender. We know for long times around, I mean, the heart disease study started 50 years back in the 1950s, 1960s. And for a long time, almost all patients who were included in the studies were male gender. patients because, of course, male have a lot more heart attack, but the heart attack is different in women. They have different symptoms, and we know that nowadays, and this is a hot topic in our community, in our cardiology community, the difference between women and men, and how different the risk factors are, but also how different the signs of a heart attack, the so-called typical heart attack signs like chest pain. And so this is not that usual in women. It's quite a little bit different. They have more abdominal pain or atypical pain, we say this, and so on. So that is an absolutely important topic, and I think in the coming years there will be more and more studies on the difference between men and women in heart disease. Right now we don't have much information on the difference about the risk factors, but still there is quite a lot of research going on in this area.
Thank you, sir, and it was great connecting with you.
Thank you.
I'll move on to the next session, that is vote of thanks. Now I invite Dr. Saumi Meriem, NAC coordinator, to propose the vote of thanks.
Thank you, Sonia. Am I audible?
Yes, ma'am.
Yes.
Respected Principal, Dr. Sister Gigi John Xavier, the Chief Guest of the Day, Dr. Aju Paul Pazhenkottil, Vice Principal, Dr. Sister Stella, Program Conveners, Dr. Sheena Xavier and Ms. Sonia John Marcos, dear friends and students. Good afternoon, one and all. The upsurge of an institution's progress is dependent on the head of the institution. And St. Xavier's College for Women Alva is blessed with a great leader in our principal, Dr. Sister Gigi John Xavier. She always gives the spur to embrace and initiate programs that will benefit the staff and student community. It's her strong support that works as a mainstay of all our endeavors. Thank you, dear sister, for being our linchpin and our anchor. There is a saying, life is lived to the rhythm of your heart. The adage itself says the importance of the care we should give to the caring of our heart. Today, we had a comprehensive session on all the terrains of knowledge regarding heart and heart care. For such an extensive and inclusive talk, we are much indebted to Dr. Aju Paul Pazhenkottil, the cardiac consultant and lecturer, Zurich, Switzerland. Sir, you have taken us deep into the heart of things and made us understand how to take care of our heart. On behalf of the Xaverian fraternity, let me express my words of gratitude to you, sir. Thank you so much.
Thank you very much. Thank you.
In the context of the pandemic, the webinar series on health is a welcome program as it will help us know more about physical fitness and healthcare. The webinar series is the brainchild of Dr. Sheena Xavier, our IQAC coordinator, who is always in the saddle to organize whatever that would benefit the institution. Her enthusiasm is a stimulus to all to move forward without cease. Thank you, Dr. Sheena. May I also place on record a hearty gratitude to Ms. Sonia John Marcos, the joint convener of the webinar series. She is the person who identified the right resource person for this session. Thank you, Ms. Sonia. My thanks are also due to Ms. Shruti Francis of the Department of English for the technical support rendered. Thank you, Ms. Shruti. May I also thank all the faculty and students who participated in this session. I do hope that the webinar will positively benefit all of us in terms of heart care. Thanking one and all once again. Thank you so much.